Hi, this is Nancy again, one of the hospice care queens. I'm going to talk now about another scale, and this one is to measure pain or overall discomfort. This scale is one that helps the hospice nurse determine the level of pain, whether it is being done during the admission process or at every visit thereafter. This scale will help give an objective score to what the patient is exhibiting at that current time. It's my favorite scale to use in evaluating a patient's discomfort because unlike the FLAC scale, this one takes in breathing comfort, and those of us in hospice know that this area of comfort ranks right up there next to pain. As I said before, it's called PAINAD, or PAINAD. It ranks 5 different aspects of the patient's status: breathing, verbalization, facial expression, body language, and consolability. This scale measures 0 points for no pain to a maximum of 10 points for extreme discomfort. Let's begin with breathing. Normal breathing gets 0 points. If the patient has occasional labored breathing or a short period of hyperventilation, perhaps with some exertion, they get 1 point. If there's noisy, labored breathing with extended hyperventilation or Cheyne-Stokes respirations, they're awarded 2 points. Moving on to their verbalization. The category is titled negative vocalization. If the patient is quiet and calm, 0 points. If the patient is making an occasional moan or a groan or talking with negative quality, they get 1 point. If there is repeated and troubled calling out, loud moaning, groaning, crying, they receive 2 points. Looking next at their facial expression. If they're calm, smiling, or even inexpressive, 0 points. If sad or frightened with a clear frown, 1 point. And if the patient is really grimacing and their face is wrinkled in concern, 2 points are awarded. We move on to body language. You know if you're fully comfortable, your legs can be and your arms are open, fully relaxed. So if the patient looks like that, of course you looked under the covers to make sure, that's 0 points. Now, if the patient is showing some tension in their body, they're in their muscles, they're holding their arms next to their body, perhaps they're up and they're actually pacing or constantly fidgeting, they get 1 point. But if the person is truly rigid, they're all curled up in the bed, their knees are pulled up, or they're perhaps really pushing or pulling at a caregiver, striking out, they get 2 points. And the last element is consolability. Hopefully most times patients are really calm, they have no need to be truly consoled. But if they're anxious, they need to be distracted or reassured with your voice or even with a gentle touch, then 1 point is awarded. However, if you try over and over to soothe the patient and they can't be consoled or distracted despite repeated attempts at reassurance, then they are awarded 2 points. So, tally up the points and then determine if any action needs to be taken. Of course, ask the patient. Let's say they have a 2 or 3, but they really don't want any intervention. They don't want to be repositioned or have a drink or any medications. Just let them be. Some people would rather be uncomfortable than even take medications or be bothered with. If this is a dementia patient, though, that can't make their own needs known, then perhaps you first need to make sure that they're physically comfortable and then assess if that lowers their score. If yes, great, move on. If not, then perhaps you need to offer some medication for general aches and pains if it's been ordered for them, such as perhaps Tylenol or ibuprofen. If the pain level is 4 and above, it's really time to look at medications for comfort. So speak to your hospice team to make sure there are options available. And then, of course, remember that with all medications, the goal is always to start at a low dose, go slow, and carefully assess how they respond. Well, that's my favorite pain scale, PAINAD. Thanks for listening, and don't forget our motto, care is treatment. We're the care queens. Go to our hospice care site, get our booklet, watch our videos, and thank you very much.